my lovelies, welcome back to my channel. I'm Genine Galano and thank you for coming to watch this vlog. So for this vlog, we're going to discuss the full application, the documents that you need, and by the end of this vlog, you will be able to know and list the documents that are needed for you to register with the NMC. I know I uploaded a little bit late this time. It's because I have a few priorities that I couldn't postpone, so I need to get them out of the way so I can do the next vlog of this series of how to become a UKRN. Because if I don't finish them first, I will be stressed about them. The first vlog I discussed about IELTS and OET. If you want to watch that vid, it's available on my previous videos. Last week we discussed about the eligibility and the CBT. It's also available on my videos if you want to have a watch. I forgot to include, for some reason, in the eligibility, I talk about personal identity, right? How they will check your identity and what do they need. So I forgot to say there are other qualifications needed for you to register with NMC and for you to proceed to CBT. So the qualification needed on your eligibility, you need to upload your qualification document or your registration document saying that you are a registered nurse in your country. So it's a document that states your name, that you're a registered nurse, and the date it was awarded. And then you have to upload the original onto the system. And they will need as well the name of your regulator. Like the Philippines, we have the Professional Regulation Commission. They award these certificates. They are the ones who regulate all the professionals in the Philippines. So aside from the name of the regulator, you have to include the contact details so the NMC can confirm if you are really registered with the regulator that you have in your country. So just a quick run through. First is your IELTS eligibility by submitting your identity evidence and your qualification registration information, paying the evaluation fee 140, and then going for CBT, and then next is the full application. Now we're gonna go through the completing your full application, NMC application. So the first one will be a health declaration. You should self-declare that you are healthy enough to practice safe and effectively. So what if you have any health conditions? What are you gonna do? So you have to declare them. It's only if you have a condition or health condition that can affect your ability to give a safe and effective health care. They will just ask if you have a condition that can affect your ability to provide safe and effective care, and if you are managing it or how you are managing your current disability or health condition. They will ask you as well for somebody to support your health declaration. You will have to provide contact details for a registered medical practitioner. This could be a GP, a general practitioner, a family doctor, or occupational health practitioner, but they can't be one of your friends or any family member. This medical practitioner should confirm that they have carried out a health assessment on you in the last 6 months and confirm they are qualified enough to support your declaration. They should verify and confirm about what you said regarding your health, or if not, they should give a statement why they don't agree on your declaration. And of course, you should contact them. Just tell them that you're applying as UKRN and that NMC will verify this submitted declaration. So the next one will be your character declaration. They will ask you if you have any police charges, cautions, conviction, or conditional charges. So the first one was like from police. The next one is like any reprimands or determinations made by any other regulatory body aside from NMC, of course, and even overseas, any regulatory body. So if you have any offenses, they will just ask about it. If you can provide more information, then it will be easier for them to assess your application. So what you're gonna do next is you have to upload police clearance from every country that you worked in for 12 months and above. For example, you have worked in Saudi for more than 12 months, you should provide a police clearance, and it should be translated because Saudi police clearance is in Arabic. It's in Arabic, so you have to have it translated. Best thing, if you are working there, you should secure police clearance before you even go for exit. And if you're not there anymore, I think you can have somebody secure it for you. You just need to give an authorization letter if that's still the case. And another thing is, if you've lived in the UK for more than 3 months in the last 10 years, you have to secure a DBS certificate as well. So there's a guide in gov.uk regarding obtaining police clearances from other countries. Unfortunately for Saudi Arabia, they don't have any idea yet how to obtain a police clearance from them. So if you are looking for another country, it might be worth checking on the link I'm gonna put in the description. So you just have to click it and check for the country that you are obtaining police clearance from. You have to nominate somebody as well to help you with your character declaration. This person should verify and confirm that you can deliver safe and effective care to your patients, and then you can practice effectively. Or they could say why you are not capable to provide a safe and effective care if they have any concerns regarding your practice. Confirm that they are not of any relationship with you, they haven't been employed by you. So who can give this declaration? First, one of your recent employers, like in the last 3 years. Your education and institution, if you haven't practiced yet, but you have done training with them in the last year. Someone who is already registered in the NMC and who you have been in contact in the last 6 months before submitting your application. Or can be a UK regulated healthcare professional who has been in contact with you as well in the last 6 months before submitting your application. And the next one in this full application is submitting your IELTS certificate. You'll need to provide the certificate and the TRF number. And if you had the 2 sittings, you should provide both certificates and the 2 TRF numbers. Right, the next thing is for indemnity arrangement. It's like a cover for just in case you commit negligence and then made a complaint about, I think. If you are in the NHS, you will automatically covered, I believe. And if you are on a private employer as well, I believe your employer has had it arranged for you as well. So there are several union here to just in case you want to cover yourself as well. There's like RCN and Unison. I am currently with Unison. You just declare it anyway in the NMC portal. So just important points, the document should be original. If for some reason you can't find the original one, or it's been lost for some time, you have to contact directly your regulator to give a statement that you are registered with them, or if they can produce another document the same as the last one, then that's probably better, but you have to contact them directly. Second point is, if your certificate is not in English, you should have it translated by a translation service. What you need to submit is the original document, a copy of the original document with a stamp and signature of the translation service, the accurate and concise translation of the document signed and stamped as well by the translation service, and then the name and contact details of this translation service that you have it translated with. Without one of these, your document is going to be invalid. Third point, for example, you change your last name because you married or you entered a civil partnership. So you have to give evidence as well that proves why you have changed your name. For example, you got married and changed your last name. So you need a relevant official body like a government office to issue a statement stating your previous name and your new name and why you have changed it. It's to confirm your identity. You can upload a scanned copy of this document, but they will need to see the original document when you go for your face-to-face verification. Fourth important note, NMC recommends that you have to contact your verifiers so they know that you're trying to register with NMC in the UK, so that they will be aware and they will respond quickly to queries and verifications, and you will have a smoother journey towards your UKRN title. So when you're ready to submit your application, you have to pay the registration fee of £153, say 10,000 pesos. So you won't be able to submit your application without paying the registration fee, so you have to pay for it. This will be refunded anyway if you cancel your application. If you withdraw your application even before it was assessed completely, if your application has been closed because you didn't return the required documents, and third, if your application is not successful because NMC thought you don't meet their requirements. So once you have submitted your application, paid the registration fee, this is now for the NMC to contact your verifiers and validate your documents and declarations. They may contact you while processing your documents. They may contact you for any additional information, or if they need more details about your health or education or your qualifications or your registration or your police convictions or charges. This is for them to quickly assess your application, and then you receive a decision earlier than expected. If anything, they will contact you by email, and then you can see in the NMC portal what they want you to do and what they require of you. They aim to finish the assessment for 30 days, but they are required to make a decision within 3 months. So that's giving you within 30 days, that's their goal, but if not, it should be within 3 months. But for me, it was pre-COVID, and that was like 4 years ago, about probably 28 days. If they haven't had any decision for the 3 months, you have the right to appeal. You can appeal as well if the NMC refuses your application because of your health, your good character, and your English requirement. You have to appeal within 28 days after receiving their decision. You can make an appeal if your application was refused because you didn't pay the required fee, or if you have submitted an incomplete application. Well, obviously, if you really want to become a UKRN, then you should pay your fees, right? And you should complete your application as well, because if not, you'll be just wasting your time. If they have accepted your application, you will undergo the IOM test or the TB test, and I'm not sure if MMR is still existent, but it's either IOM or both of them. And then, welcome to the UK. It's a little bit long now, so we'll keep the OSCE on another vlog, on a separate vlog. So for now, that's your full application. Just remember, upload and bring your original documents. If you need it translated, also bring the original one, and have the copy stamped and signed by the translation services. You need to get their contact details as well, and then if you changed your name, provide evidence as well as to why you have changed your name. And then and don't forget to tell your verifiers that you are applying for NMC to become a UKRN, so that they know and they're aware and they know what to answer, how to answer NMC. So that's all for today. Thank you for watching this vlog, and I hope you have a smooth ride, smooth journey towards becoming a UKRN. And I hope to see you in the UK. Bye, till next time.